My name is Beth McCauley. We have a crisis in healthcare today. No, the crisis is not about healthcare reform, access to care, or the cost of care. This healthcare crisis is about losing hundreds and thousands of nurses and other healthcare professionals due to disabling and often career-ending back injuries due to manual patient lifting. There's no other profession that expects its workers to manually lift hundreds of pounds each and every shift. I am advocating for a safe patient handling program in healthcare facilities across the country. Safe patient handling programs can save our nurses and our healthcare workers. U.S. healthcare workers are ranked in the top 10 occupations experiencing on-the-job injuries due to hazardous manual patient lifting. Lifting patients results in 5 times more overexertion injuries than any other type of work. Nurses suffer injuries at higher rates than any other groups, such as movers, truck drivers, construction workers, auto manufacturers, miners, and shipyard workers. U.S. healthcare workers reported 248,221 injuries annually due to manual patient lifting. That's a lot of injuries. Nurses have the highest rate of back pain among healthcare personnel. The cost of these injuries is huge. It's estimated to be between $20 and $50 billion. Lifting injuries average $25,000 without surgery and $40,000 to $85,000 with surgery. There are tons of reasons to provide patient handling programs. Obesity is an epidemic in the United States. 34% of the U.S. adult population is obese. That is more than double what it was 30 years ago. The percentage of obese children also tripled during that same 30-year time period. Now let's talk a little bit about the nursing shortage and how these injuries contribute to the nursing shortage. 12.6% of the 2.9 currently registered nurses in this country will leave the workforce every year due to manual patient handling injuries. That's 365,400 nurses that are taken out of the workforce, and we already have a shortage. Nurses hurt by manually lifting patients and leaving the workforce is estimated to be one of the top contributors to the nursing shortage. The U.S. shortage is projected to be over 260,000 nurses by 2025. Nurses are aging. The average age of the registered nurse will be 44 and a half years old by the year 2012. This is happening at the same time the size of the RN workforce will level off as large numbers of registered nurses retire. A nursing shortage of this size would be twice as large as any other nursing shortage since the 1960s. Mature nurses have told us that they're willing to stay in the workforce if they are provided with safe patient handling equipment, meaning they don't have to manually lift patients. How many tons can a nurse lift in one 12-hour shift? First of all, this is a crazy question to even be asking. What's the answer? The answer is that the average nurse working a 12-hour shift, taking care of 5 patients that weigh an average of 185 pounds, will lift 2.7 tons or 5,400 pounds each and every 12-hour shift that he or she works. Other countries have solved this problem of devastating back injuries in manual lifting. We can do this too. England and Australia passed no-lift legislation in 1996 and 1998 respectively. They have very strict laws and do not allow manual patient lifting. 10 states in the United States have passed safe patient handling legislation, and that's great. That's a good thing. However, 40 states have not passed safe patient handling legislation. The 111th Congress is currently considering 3 safe patient handling bills. However, they seem to be stalled in committees and subcommittees. 5 to 10% of the current hospitals in the United States have safe patient handling programs today. That means we still have a lot of work left to do. We can implement safe patient handling programs and fix this problem. A safe patient handling program is created when healthcare facilities provide equipment and tools to lift, transfer, and turn patients, thereby eliminating staff having to manually lift patients. Many healthcare facilities, including the Veteran Hospital Administration, have virtually eliminated healthcare worker injuries. Thank you for your time, and I hope you will ask your local hospital if they have a safe patient handling environment.